Hi folks, I'm going to show you SunCoast Connections PQRS Pilot, a PQRS reporting tool that allows you to efficiently complete your PQRS reporting for the year. At this point, you will have already sent us your claim batch files, which contain all data related to your patient encounters for the last year. This includes diagnostic, procedure, and outcome codes that are submitted to CMS. At this point, your data has been imported into a fully functioning EHR system, but we're not interested in that right now. Let's look at what we're going to do today, PQRS. Now, the first thing that we want to do is select your PQRS measures that you want to report under. Okay. Now, we provided some quick pick specialty types which will allow practice to quickly select individual measures that may be appropriate for their specialty. An even more efficient way to complete PQRS is to use a set of group measures, such as, let's say, coronary artery disease, or CAD, which has good examples of measures found in these types of groups. Now, let's update our selection here. Now, it's time to run a measures report. We're doing a group measure. And we will submit that. Part of why this is so efficient is that you only need to pick 20 unique patients, which can be reported by every provider in the practice. This is much easier than individual measures, where you have to report on all your Medicare patients. Now, you see we've got 6 measures in the coronary artery disease group. We have 15 patients in our population, and 11 of those pass the denominator for coronary artery disease measure number 6 here. All right. Now, we'll also see that we had 11 patients passed. That generally means that there were some CPT2 outcome codes that were sent along with your billing data. Not everybody sends these codes every time they should, so you will find that some or all of your patients in one measure group or another have failed. Here we've got one exclusion. An exclusion is a condition where they had the appropriate diagnosis, but another condition, such as an allergy to a medication, causes them to be excluded from the normal indicated protocol. Thus, we do not have to have them in our past numerator here. They will add up to our performance percentage without them showing up as a failed patient. All right, let's make these patients pass. Let's look at measure number 226. What is that? Now, we could bring up our patient list here under denominator, but we're interested in the ones who have failed, which were all 11. Looks like it's preventive care and screening, tobacco use, screening, and cessation intervention. Now, the first thing we notice is that Jackie Doe has got the CMS logo behind her name. That means that Jackie has got Medicare. Now, we ask, was Jackie counseled for tobacco cessation? We find a note in her medical record that says, yes, she was, and that she's a tobacco user. So we select answer number 1. Now, looking down here, you see Webster Wise is not a Medicare patient, but we only need 11 out of our 20 total that are required for a measures group to be a Medicare patient. So that's just fine. Okay. Let's make the rest of these complete. We go through our records and we find out that Jeff Doe is not a current tobacco user. Neither are the rest of these guys. Jacob, poor guy, is. And we keep going down our list, checking our record and deciding what they are supposed to be reported as. Now, we update each of these patients as we finish until our list is complete. Now, if I return to the report results, you can see that they still show up as failed under measure 226. That's because we're looking at an old report. So what we really, and you can see this by looking at your report results, and you can see that we ran that report a while back. It's an old report, but we want to run another one to show the updated results. This gives you a full history of each and every report that you've run and the status of completion as you go along. Takes a few more seconds to run here. Great. Look here. We have now completed group measure 226. We have 0 failed, 100% performance rating. Outstanding. You can see with a little bit more work here, we could answer all the rest of the questions we require for this measure group. Here's BMI documentation. Everything would proceed pretty much the same as before, with the exception, of course, is you can go through each and every one of the failed sections in a report, complete them all, then rerun the report one last time to get your passing results. Thank you very much, guys. Appreciate you listening. Have a good day.